Hello, I'm Foojan Zeine, and welcome to the Inner Voice Show, where we talk about what matters most to you in your life from a psychological perspective. I am so excited and honored to have Dr. Dan Siegel join us today. I would like to tell you a little bit about him. Dr. Siegel received his medical degree from Harvard University and completed his postgraduate medical education at UCLA with training in pediatrics and child, adolescent, and adult psychiatry. Dr. Siegel is currently a clinical professor of psychiatry at the UCLA School of Medicine, where he is on the faculty of the Center of Culture, Brain, and Development and the founding director of the Mindful Awareness Research Center. An award-winning educator, he is a distinguished fellow of the American Psychiatric Association and the recipient of several honorary fellowships. Dr. Siegel is also the executive director of the MindSight Institute, an educational organization which offers online learning and in-person lectures that focus on how the development of mindsight in individuals, families, and communities can be enhanced by examining the interface of human relationships and basic biological processes. Dr. Siegel has published extensively for the professional audience. He's the author of numerous articles, chapters, and the internationally acclaimed text, The Developing Mind, How Relationships and the Brain Interact to Shape Who We Are. This book introduces the field of interpersonal neurobiology and has been utilized by a number of clinical and research organizations worldwide, including U.S. Department of Justice, the Vatican's Pontifical Council of the Family, Microsoft, and Google. Other books written by Dr. Siegel are The Mindful Therapist and MindSight, The New Science of Personal Transformation. He's also co-authored two parenting books, Parenting from the Inside Out and How a Deeper Self-Understanding Can Help You Raise Children Who Thrive, and The Whole Brain Child, 12 Revolutionary Strategies to Nurture Your Child's Developing Mind. Dr. Siegel's latest release is the New York Times bestseller, Brainstorm, The Power and Purpose of the Teenage Brain, which explores how brain development impacts teenagers' behavior and relationships. He has lectured for the King of Thailand, Pope John Paul II, His Holiness the Dalai Lama, Google University, London's Royal Society of Arts, and TEDx. Welcome to my show, Dr. Siegel.
Thank you, Foojan. How are you today?
I'm doing great. It is so exciting for me and such an honor. I've been to your lectures in many places, and I've been lucky to have your books and lecture your books to the places that I've lectured. And it's just so great to have you on my show and to share you with my audience, which really don't get to see you.
Wonderful to be here. Thank you for having me.
I know that you have kind of claimed and created the word mindfulness and mindsight, actually. Tell me a little bit about that.
That's 2,600 years old as a practice. But mindsight, yes, mindsight.
Tell me a bit about that.
Well, it's interesting because many people think mindsight and mindfulness are the same word, but they're not. Mindsight is a word that I made up when I was in medical school and was so disillusioned by my professors not seeing that people, like their patients or their students or perhaps even themselves, had an inner life of the mind that includes your thoughts and your feelings, what things mean to you, the narrative, the autobiographical story of your life. All these things are part of the mind, and I noticed in a painful way that my teachers didn't see the mind. So I dropped out of school, and during the period of being away from my schooling, I made up this word mindsight. And I told myself when I went back to school that I should be careful of people who didn't have mindsight and make sure I didn't become like them, and really try to look at the people who did have mindsight and learn deeply from how they had empathy, insight, and ultimately could also create something called integration, which is the linkage of differentiated parts. So mindsight has those three elements: insight into yourself, empathy into the understanding of someone else, and integration, which is where you honor differences and promote linkages. And those three things are what mindsight is.
Great, thank you. Now, let's talk about your latest book. I know that this is a great gift to parents and teenagers, both alike, because this is the first time that we have come to really learn what the brain of a teenager looks like and what it does. You have talked about a couple of myths that the parents have had, and even myself as a psychologist, I have had those myths. One of them being that one of the conversations I heard you have is that adolescent used to be from something like 16 to 18 years of age, because people used to get married and be responsible and had to become an adult. They really didn't have a choice to stay being an adolescent. And yet today, as we have it, it somehow starts from 12 years of age, and as a joke, it can also go to 45, but really somewhere around 24, 25. So the time of adolescence has really shifted. So tell us about what your findings have been.
Well, over the last 100 or 150 years, it's exactly what you're saying, Foojan, that we've seen the beginning of adolescence, which is a rough estimate to be around the start of puberty, to become younger and younger for many reasons. The specific reasons we may not know, but they may have to do with nutrition especially. So people are beginning puberty, girls a little bit before boys, about a year and a half or so before. And that's around now 13, 12, 11, 10. You know, you see the beginning of menstruation in girls and the development of boys as well, getting much earlier. And then the period that we're, at least in Western cultures, staying in the learning mode, if you will, and not settling down with work responsibility and with responsibility for raising a family, has gotten later. So it's not around 18, 19, 20. Girls, again, earlier than boys, but is extending now certainly into the mid-20s, if not into the 30s. So that's a lot longer period. That's 2 decades, where it used to be just 2, 3, 4 years before.
And you've talked about some of the changes that happens, that it isn't just because of hormonal changes, because we've really, many times we've just kind of like shunned and said, well, it's just going through a lot of emotional ups and downs because their hormones are changing. And you stated that this isn't really hormones. There are changes in the brain that have to do with chemical changes and different changes, but not necessarily just hormonal changes. And that has shifted the view of how we can treat teenagers and understand and have empathy for them. So let us know a little bit about how the brain functions in those ages, so we know.
Yeah, exactly. Well, the myth that we're all told, of course, is that hormones are raging out of control. I know when my 2 teenagers, who are now in their 20s, you know, were going through that period, and you asked fellow parents of this age what's going on, they said, oh, the raging hormones, you know. It's a common thing all around the world, but while hormones rise because of puberty, they're not raging, they're not angry hormones. How the brain responds to those changes of puberty are really what we're beginning to learn about. And those changes basically can be summarized with the word remodeling. So while the first dozen years of life or so, the child's brain is growing and growing, making new connections and soaking in the adult world and the world of fellow kids that you're interacting with as a child. Now, when adolescence hits, which is roughly around the time of puberty, 2 things happen that are the remodeling. One, instead of just accumulating new connections, the brain starts to actively cut away existing connections among the cells of the brain called the neuron. These synaptic connections, are what they're called, begin to get carved away, and even some of the neurons begin to get removed. That process of carving away and removing is called pruning. So the first thing that's happening is there's a pruning away of what was established in the first dozen years of life. That surprised everyone, the extent of this pruning.
Well, it really makes sense as an experiential place because I work with a lot of adolescents, and I've experienced talking to them, and they come in very frazzled with their parents, and they feel bad because they come in around maybe age like 12, 13, or 14, somewhere there, depending on whether they're girls or boys. And they're in my office saying, Foojan, I don't know what's going on, but I feel dumb. I'm the same person. I go into school, I read, I can't take anything, and my brain just doesn't receive anything. I'm bored, I don't want to do anything. And it changes by itself also, and I know that they freak out at that time, and their parents freak out. And what you say now makes sense of this is what's happening in their brain, and some of the neural networks are actually releasing and dissipating and waiting for new neurotransmitters to actually go back and recreate themselves, right?
Well, yeah, so after the pruning, and also overlapping with it, is a second process called remodeling. The remodeling particularly is myelinization. So we have remodeling, has pruning, and the laying down of a very healthy connecting sheath that's an insulating sheath called myelin. M-Y-E-L-I-N, myelin. So myelin allows these neurons that are remaining to be about 100 times faster in how the electrical charge is passing down their long lengths, and it's about 30 times quicker to recover from your firing. It's called a refractory period. And so 30 times 100 is 3,000. So the number to remember is that when you've laid down myelin, among the neurons that are still there and the connections that can be even strengthened, you've become 3,000 times more effective. Mm-hmm. Now, that's both speed and it's also coordination. So ultimately what we say is this period of remodeling leads to increased integration in the brain, where the brain is actually more efficient at doing what it's doing. So the remodeling period is different from just learning, because as your patients, your clients tell you, there's a period like in a remodeling zone. If you go to a reconstruction site for a building, you have the basic building, it's working fine, but now you're going to tinker around with it. So you build a second story, you're going to improve the plumbing, you're going to change the electricity. During the period of remodeling, those functions don't work so well. Mm-hmm. So we have to give space for an adolescent rather than pressuring them like a building that's being reconstructed. You say, I want this plumbing to work. Well, no, sometimes you have to undo the plumbing and reconnect it. So this is what I hope the Brainstorm book can do, is give parents and adolescents, as well as teachers and therapists, an understanding of how this remodeling is happening, because we actually, as adolescents ourselves or as adults, can support the remodeling period in a very useful way that I talk about in the book, whereas raging hormones or just saying it's a period of craziness, or someone told me in French the term was the stupid age, those are all disempowering, insulting comments that the science doesn't support.
Right.
We can feel out of sorts and can feel stupid, but it's not a stupid age, and it's not a period of craziness.
So knowing this obviously supports parents and the teenagers to have an idea on what's happening in the process, and that they don't get scared at, oh my God, we're going, my kid is getting stupid, or the teenager feels that, and then that becomes part of their identity, or that becomes part of the frustration and rage for the parents, and they insult their kids, or they put much more pressure. So if you could give some advice to the parents who are going through this, how could they treat their teenager at this time so that it's easier for them as a parent, and that it also empowers their teen rather than insult or disempower?
Well, Foojan, you're saying it in such a beautiful way. Thank you. This is exactly the issue. The first thing to tell a parent is that when you as a parent understand the basics of what's going on in the brain of an adolescent, and I myself as a parent of adolescents was shocked to see that there are no books that explain that to you as a parent, and there are absolutely no books that help a parent and the adolescent learn the same material, say about the brain, and then understand that what you as a parent do or what your adolescent does with the focus of your attention can actually change the way this brain is being remodeled. So what I say to the parents is this: when you learn the truths about the adolescent period, that it's a time of remodeling, that it's a time where there's an essence we can talk about, that you can support the core way an adolescent brain changes, has 4 fundamental features. And when we understand those, what you can do as a parent is support your adolescent, having the kind of emotional connection with them that's really important. So rather than you getting really upset that they're not doing what you expected, give your adolescent some space. Ask them how they're feeling, what they're doing. Sometimes they're going to feel one way, sometimes another, because emotions can be very intense. And even just that beginning of backing off and saying, I believe in my adolescent, I'm going to understand this is a period of remodeling, and I'm going to be a support system for my adolescent rather than someone pressuring them. And then once you just take that first stance, there's specifics that we can talk about, Foojan, about what you can do to literally help your adolescent optimize the positive growth of their brain and minimize negative aspects of these changes like risk-taking behavior. And so those are very specifics we can talk about, but the first thing is just to take a deep breath, realize that this is a period of remodeling that you can actually support as the parent of an adolescent.
You said a beautiful thing in your book which says, don't look at just what's going on with your adolescent today, because how you talk to them creates, for them, because they're trying to create their own identity, somehow sets up that identity. So it'd be beautiful for the parents to act with their teens as if they're already the identity, the beautiful identity of the person they want them to be. And if you're acting toward them as that, as if they are that already, that they will automatically start behaving that way and see themselves as that. Such as, if I keep calling my adolescent, you're stupid, you're good for nothing, that's what they will come up as an identity for themselves, that I'm stupid and good for nothing, rather than if I tell them that you're amazing, you're a great kid, it's just something's going on right now. That's okay. The same way you're growing and you're having growing pain, something's happening with your mind right now and you're having, some vacuum feeling at that point, and it'll be shift, and we know your greatness. So that's the part that I understood from your book. Can you say more about how parents can hold that vision of a greatness as an identity for their teens while they're going through this process?
Well, yeah. I mean, the idea in the book is exactly like you're saying, Foojan, that, we are very social creatures. So we adults and we adolescents and adults pick up the expectations of other people. Studies have shown this in school, for example. If a teacher expects very little of students, let's say, on the left side of a classroom because she's been told they're not very capable, those students will not achieve very much. And if she was told, oh, the ones on the right side of the classroom, they are so gifted and talented, they actually will perform better. You then switch and you said, oh my God, we made a mistake. The ones on the left of the capable ones, the ones on the right are not very capable. Just her being told that switches the outcome. So the point is that we all pick up what people expect of us. So if you as a parent have been hearing in the larger world of media and fellow parents, teenagers are crazy, it's a period of being stupid, it's a time, like I go around giving lectures on the adolescent brain, even the professionals introducing me, often, this has happened now 4 separate times, the professional will say, Dan is going to talk about the adolescent brain. I didn't know they have one.
Oh.
If you get that message, even from professionals, you're going to start feeling helpless.
Yes.
You're not only insulted, you're disempowered.
Yes.
So what I suggest is exactly what you're saying, is learn the basics of what happens in the brain. It's these 4 elements of an emotional spark, social engagement, novelty, and creative exploration. It spells the word essence, and we can go over those one by one. But when you, as a parent, understand the essence of adolescence, what it's going to do is allow you to picture how the positive side of each of these four can be optimized. So you literally can envision in your mind an optimal way that passion in your child can now, as an adolescent, be brought to their drive to explore the world and to experience life with vitality. Mm-hmm. And you go through each of the others of the essence. And when you picture that, your adolescent will pick that up. Mm-hmm. And in picking that up, you're kind of carving out the future for them. It's not like you can think they're going to be, 8 feet tall and they'll become 8 feet tall. So it has to be reasonable. But when you have an expectation of where they could, in fact, go, they're more likely to get there than if you just believe there's nothing you can do and there's nothing they can do. They're bound to be in this horrible adolescent period. And we can go through, if you'd like, each of the four of the essences, elements of the essence, because when you do that, then there are very specific ways you as a parent learn to actually support your adolescent to become the best adolescent, to become the best them that they can be.
I would love to hear the four. If I could say a comment so that as you're explaining the four, you would also address this. Now, some of the cultures where are more authoritative from a parenting position also hold a lot of expectations about what the future of the future career of the child should be. So distinguishing between, I'm going to tell my child that you have to be a surgeon, and anything less than that is not appropriate, or you have to be an attorney, or you have to be, the top billionaire of the world, and anything less than that is just not going to be acceptable, is not what we're talking about. It's a whole different way of holding an identity in a positive way for your child, rather than dictating to them what their identity ought to be. So as you're explaining the four, can you also attend to this, because some of my audience are more of an authoritative parent, and I just wanted to distinguish between the two.
Right. Well, yeah, and that's a very important cultural point, and certainly I grew up in a culture very similar to that, so I'm happy to speak to that from personal experience of how destructive it is when a family does not see you for who you are, but projects onto you their own expectations of externally what occupation you should be, because it's in many ways it's a painful way of not actually seeing the individual for who they are, but just trying to make them conform to what you think they should be. So yes, thank you for pointing that out. And in the professional literature, there's a term that gets very not used that much, but the difference between authoritarian and authoritative. So in the research, you have three kinds of parenting. You have permissive parenting, you have authoritative parenting, and you have authoritarian. Now, in English, authoritarian and authoritative sound so similar that in my own teachings I try to avoid using these three, because everyone puts the last two that sound identical together. But the idea is that some parenting, authoritarian parenting, is where a parent acts like a dictator and is dictating like an authoritarian leader of a country. This is exactly the way it has to be, and it's like a dictatorship. Authoritative is a parent who creates structure, and within that structure, you figure out how to stretch your wings as a child. So authoritative parent is where you say, you must be in bed by midnight because you're an adolescent, you need to get your sleep. And if a child comes in at 12:10, you say there's a consequence to you coming in 10 minutes late, so that next time you're going to actually have to come in at 11. Okay, fine. An authoritarian parent might say you have to be in bed by 9. I don't care if your friends are out, and if you're later than 9, you're going to be banned from seeing your friends for 2 months, something like that. So you can get a little bit of the feeling of the difference. An authoritative parent is really trying to understand the child's individual experience while setting structure. An authoritarian parent doesn't care about the experience of the child, so they're more like a dictator, doesn't care about the citizens.
Mm-hmm.
So, and permissive would be, you do whatever you want.
Right.
And individuals, children, adolescents, they need structure. And kids who are raised in a permissive household, research shows, don't develop the kind of internal regulation and self-worth that a child raised in an authoritative family does. And the ones raised in authoritarian, they actually don't have the kind of self-worth, feeling good about themselves, that someone who's raised in an authoritative family does. So those roughly correspond, not exactly to attachment categories, and that's a whole other discussion, but you know, the research I do is in attachment, where we look at a slightly different set of categories, but they roughly overlap in a similar kind of way. It's not identical, but it's similar. So, in terms of the question about the four aspects of essence, Foojan, you can tell me as we go. There may be a cultural translation across different cultures around the world that you might have insight into that I might not be aware of. So as we go, let's do this together.
Okay.
So, you know, because that issue about, you know, being an authority as a parent versus a dictator is important to distinguish for all cultures.
Right.
So first essence, it's spelled E-S-S-E-N-C-E. That spells the English word essence, and the English word essence means, you know, the core aspect of something, the heart of something, the fundamental, central experience is what essence means. And luckily, when you look at the brain studies and rearrange them in their order, you realize that the 4 ways of understanding the remodeling of the adolescent brain turn into 4 things that can spell the word essence, and I like acronyms, so it's useful. So the first one is ES, emotional spark. So if you take your hand and put your thumb in the middle and put your fingers over the top, this brain would be oriented like this. I've got a brain right here. You can kind of see it would be oriented this way. And in this brain, in my head here, the emotional flow comes from the body, which is represented down here in your arm. The spinal cord would be your wrist. Then in the first part of the brain, you have the brain stem. And the second part, these are the lower parts of the brain, is the limbic area. And emotion comes from the body, the brain stem, and the limbic area. And it comes up in the highest part of the brain, the thinking part of the brain is the cortex. What we know about the adolescent modeling is that emotion is more intense than with a child or an adult. And what it means is that feelings, not just sexual feelings with puberty, but emotions of fear and anger and sadness and excitement and joy and surprise and shame and disgust and all the rainbow of emotion rise up from the body, the brainstem, and limbic area, and impact this higher reasoning part of the brain, the cortex, in a bigger way. So we just need to know that adolescents, in their essence, are highly emotional. The reason for that is it gets an adolescent energized, evoking motion is the way to think about emotion, so that they're going to ultimately get ready to move out into the world, as adolescents will be doing. The downside of emotionality is that you can feel irritable, moody. You can feel like you can't trust your own inner experience because the feelings come and go so quickly and they're so intense. You can become depressed, though depression isn't the common thing in adolescence. It is more likely to have its onset during adolescence, especially in females. But major psychiatric disorders have their onset during adolescence, probably because of the remodeling. But that's different from just being more emotional. So basically, that's the downside of the emotionality, is this intensity, this irritability. The upside is that life is filled with passion, it's energized, it's vital. It has this sense of being really alive, that things matter. And that can be a wonderful, wonderful way to live, not just in adolescence, but throughout the lifespan.
Absolutely.
Have this emotional spark is what the ES stands for. So from a parenting point of view, what you want to do is support your adolescent to learn about her feelings, to understand the way his mood affects his thinking. Because this is all the way you build the skills of emotional intelligence, which is one of the most important skills we can leave our home with and go out into the world with resilience, is if we've developed a way of not avoiding our emotions or being frightened of them, but if they're like waves on the shore, learn to surf those emotions so you can work them well.
And the more that they actually learn how to handle their emotion, and they're taught by their parents in how to handle their emotion, the less maybe that the child will go, the adolescent will go toward numbing it because it's flowing too much through alcohol and drugs. This is also the years that there's so much emotions that they don't know what to do. Somebody tells them, here, take such and such, and they'll have a relief from it, and they will get hooked. But having parents to come in and understand those emotions, and then they don't, for the parents not to get overwhelmed or maybe even insulted. I know in some of the cultures that parenting does not necessarily value the children's emotion. What happens with it is that the parents feel insulted when a child comes in with a extreme emotion. They don't know what to do, and they just shut it down. Even the parents shut down the emotion of the child because they have no idea what to do with it. And as you're talking about it, is understanding it, knowing that this is part of growing up, teaching them how to handle the emotion, teaching them to talk about it, name it, and release it, and bring the integration of what they're thinking and they're feeling together. It gives the child some skills.
Exactly. And this is something which is so important to do. I call it name it to tame it. When we put words to feelings in our relationship with our adolescents, we're literally reinforcing the circuits in the brain that help them regulate their own emotional life. So it's very, very important what you're saying. And the great news about understanding even just this first aspect of the essence is, instead of saying, oh my God, it's raging hormones that's making my adolescent so moody, and there's nothing you can do about raging hormones. You're not going to filter your blood and take out the hormones that are raging and leave the other ones in or something. I mean, that statement, first of all, is wrong, but secondly, it is disempowering for you as an adult or you as an adolescent. There's nothing you can do about a raging hormone. Yes. But when you understand its remodeling of the brain, you can learn skills that actually change the circuits of the brain. This is why it's so exciting to be talking with you, Foojan, about this and bringing this out into the world, because people are empowered to use their relationships and their mind to literally change the circuits in their brain. That's been research proven. Science has proven that the way you focus attention through the inner reflection or even through relationship communication changes the circuitry in the brain, and you can do it for the good or ignore it, and it'll develop toward the negative. So that's the first thing, emotional spark. The next one is ESSE, is social engagement. The adolescent brain is changing in the limbic area in a way where, instead of, like other mammals, just going to your parent to be soothed when you're distressed, an adolescent is now, with this remodeling of the brain, going toward peers more than just parents. And some parents feel very rejected by this. And just like you mentioned, Foojan, about the importance of the parent really giving a kind of spacious presence, if you will. I talk about it as presence in the book, where you give room for your adolescent to be emotional. The same thing is about social engagement. You want to maintain the lines of communication with your adolescent while also respecting that their brain is pushing them to engage with other adolescents more than a child engages with other children. Now, for some of us, I can speak for myself, I felt rejected when my teenagers did this. I felt like, oh, I must have been doing something wrong when in fact it's that I was doing something right. Because if you look at our whole history as a human species, even other mammals have adolescence. When adolescent mammals get ready to leave the nest, the way they survive is by engaging with other adolescents. So for an adolescent to feel like they don't have a peer group of other adolescents to belong to, the feeling in their ancient brain, the reptilian brain and the old mammalian brain, these lower areas, is to feel like it's a matter of life and death. So we don't have to buy our adolescent every shoe they want or let them go to every party they want to go to, but we can at least understand that the feeling, I need that shoe or I need to go to that party, is coming from an ancient history of if I don't belong to that adolescent group who's wearing that shoe or those adolescents are going to that party, I will be out on my own and I'll be dead. So it doesn't mean you have to buy the shoe or let them go to the party, but understanding from the beginning that the feeling of needing to belong can feel that urgent. So that's the reason for it. The downside of this social engagement is that an adolescent can let go of their values in favor of belonging. In other words, they can give up morality for the sake of membership.
Yes.
And we see this in adolescence in a big way. It's a serious risk because the drive to belong is so strong that you sacrifice what you may feel is right and wrong.
Yes.
So, that's the downside. The upside is, if we can have adolescents develop what I call an internal compass, being in touch with their heart and their gut, the feelings of positive ways of being in the world, respecting other people, valuing education, really respecting the integrity of everyone. These internal values, if you hold on to them, can allow you to socially engage with other adolescents in a positive way because social relationships really promote well-being, they promote mental health, medical health. They're even the best predictors of how happy we are and how long we'll live. So learning these skills of social engagement is important, but minimizing what's called peer pressure and the way we give up morality for membership is also something just to be named. It should be named so that we can deal with it directly.
My God, I wish I had 3 more hours of you on the show. Unfortunately, our time is not allowing me. I really want the viewers and the audience to go and get this book, Brainstorm. You can get it from Amazon.com. You can go to DrDanSiegel.com and get the book or have more of Dr. Daniel Siegel with you. It's an amazing book. It's a book that you with your teenagers can be reading, understanding, and forming another relationship, which is a healthy relationship together rather than not understanding and both being frustrated. Brainstorm, it's on the screen right now, as you can see it. Dr. Siegel, it's been such a pleasure to have spoken with you. I wish and I hope that you'd honor us again and once in a while come to the show, and as you have new insights and new books and new research, as I know you're very, very busy constantly with new items, to come on and share it with our audience.
Thank you. I'd be happy to, Foojan. Thank you. It's been a pleasure to be here with you today.
Same here. Thank you so much. I will say goodbye to you and thanks. And to the rest of you, thank you so much for being with us. Until next Monday, create a wonderful day.